So as Nadine said, I'm representing HSE, but I'm also going to say a few words about the ESTHER programme. Now, most of you are very familiar with it. Some people are not, and so I will, during the course of my remarks, just say a few things. And perhaps just to start by following the remarks from Professor Frank Murray, and who referred to the Equals Initiative. And I think this initiative, I think it really epitomises or captures so much of what ESTHER is about. Starting with the partnership in Ireland between the health service and the college here. And then that partnership extending to work in Zambia and developing a partnership with the ministry there. And what it does is, I think, so nicely, is it brings together the complementary capacities of the two organisations here. So within the HSE, we have medical expertise, we have biomedical engineering expertise, global health expertise, lots of used medical equipment. And here in the college, this world-class training institution and the capacity it has in medical training. So bring that together offers huge potential to work with partner countries. And it's been nice to see the development in Zambia and to see this shared vision that for the future of Zambia, where the country would have hospitals with functioning medical equipment, with people trained to maintain the equipment, with specialist doctors to provide the care using the equipment. And the outcome of that is better quality of services, access to better quality of services and good health outcomes. So I think we're very excited about what can be achieved there. And maybe just to add one thing about that is that I think it highlights the importance of other links, because it's not just those three partners. There's many other partners involved. So we have, for instance, in Ireland, we have partnership developing with the Irish Medical and Surgical Trade Association. So that gives us relationship with over 100 companies in Ireland who provide medical equipment, and the potential for them to become involved with donating equipment, but also to assist with training. There's the involvement of other training bodies, the involvement of West Park Shannon, who provide a warehouse for us down in Shannon to store equipment. DHL are helping us with transporting equipment from hospitals to the warehouse. And then on the Zambian side, important links there. Important links with TET. Andrew here is from TET in the UK. TET have an office in Zambia, and we collaborate very closely with them. They were the pioneers of the biomedical engineering training programme in the Nortec Institute. And there's also the Zambian UK Health Workforce Alliance that we're connected with. And then the Irish Embassy in Zambia and linked in with the development programme there. And then there's a further connection to other partnerships. And we'll hear later this morning, Dermot Donovan will speak about the partnership between CELTA, the hospital group in the west of Ireland, with the Copperbelt University in Zambia. So that's another important connection. So all of these connections work together. And I think the Equals Initiative is just a good example of that. So coming back to today, I mean, for us in the HSE, I think this is a milestone event for the ESTHER programme, but also under the MOU between Irish Aid and the HSE. And we've had a number of these important events along the journey. And I'm sorry that the Development Minister is not here to be able to see this, because we've had a number of the ministers at different points at key points along the way. In 2010, we had the signing of the MOU between the HSE and Irish Aid, and Peter Power was the minister then. Then in 2012, Minister Joe Costello, he signed the declaration for Ireland to join the European ESTHER Alliance. And then the following year, in 2013, he launched the ESTHER Ireland programme. And then we had our first funding from Irish Aid in 2014, which enabled us to establish a secretariat and then to start a small grants programme. And really in a short time, I think there's been a huge amount of progress. And that's what's, I think, nice today, is to see, have so many people here who are involved in some of these partnerships and to see the progress that's been developed. And what we're seeing, I think, is with the Irish Aid collaboration, along with the committed involvement of people like yourselves from the HSE, from other institutions, HSE-funded institutions, training bodies, general practices, etc., and working together often on a voluntary basis, and I think contributing to partnerships that are making a difference. And I think now we're at that point in the development of ESTHER where we're starting to see some of the results. And this is, I think, a very good, tangible example of Ireland's international development policy, One World, One Future. And it talks about a whole-of-government approach. It talks about harnessing the capacity of Irish institutions. And I think this is a very good example of lots of Irish institutions getting involved, contributing to the objectives of the Irish Aid Programme, and in many cases working directly in countries where Irish Aid has programmes and in support of those programmes. So I think this is a good example of effective aid, but also very good value for money. Another thing that at this point is we're starting also to get a better understanding of the reciprocal benefits for our own health service. And we've done some research on that, and that will shortly be published, that identifies many benefits for the individuals who are involved, but also for the institutions they come from. And the case study document that Nadine referred to, I think we'll give you some examples of some of the links and the learning that we're getting back from that. And I think today is a lot about learning. We will teach each other. We're all on similar types of journeys, and we can learn from our experiences of what works and what doesn't work. So to say a few words about the ESTHER Alliance, for those of you who are not familiar with it, the European ESTHER Alliance was established in 2002 by the French government. Initially, the focus was on quality of services for HIV in hospitals. As it's developed over time, other countries have joined, and it's expanded to address many other priority health issues in support of global development goals. So Ireland was the 12th country to join in 2012, and we're still the newest member. And what defines the alliance is the approach. It's about institutional health partnerships, or twinning. So European institutions working together in equal collaborative relationships with institutions from low and middle income countries. And it's about strengthening health systems. Health systems require strong institutions, so it's helping build strong institutions, building their capacity. And it's about peer working. It's about people like ourselves who are working in health in Ireland, working with peers in the partner institutions, and through that developing capacity on both sides, and leading to better quality of care and contributing to better health outcomes. A key thing for the European ESTHER Alliance is the idea of quality of partnership, and the European ESTHER Alliance has a charter for quality. So a lot of what we're about is in the alliance is not just promoting partnerships, but ensuring that where they develop, that they are committed and follow the highest standards in quality of partnership. So that's in terms of the whole development approach, but in terms of also the relationship and the way of working as equal partners in the relationship. So under the European ESTHER Alliance, there's now a strategic framework that guides the work, the collective work at the European level, and the board was established last year. And there's two key streams of work at the European level that are of a great benefit to us here. There's a coordination and collaboration working group, and what that group is working on is how can we as individual countries with our different ESTHER programs work together. So at the European level, that is partly about things like fundraising, but at the country level, there's potential opportunities for us to work with other partnerships in countries. So that's something that hopefully develop over time. So whatever country your partnership is in, there is the potential to work and link in with other partnerships doing similar work, and there's the potential added value of that. And also one of the developments for us that's come out of that working group is of that collaboration is we have a joint project in Liberia where with the Ester France program, which is now called Expertise France, and someone will share about that a bit later on. There's also a working group for evidence and effectiveness, and this is really important to us because what's important in what we all do is that we get results. It's not just about having these nice relationships with other countries. And the evidence base we recognise for institutional partnerships is still developing, and so we're very keen to develop the evidence of what works, to assess the work we're doing, and then also to publish it, and to really try and really strengthen the evidence around how this type of work of institutional health partnerships contributes to better health and development. So then under the alliance, then each individual country has its own ESTHER programme. Each one is distinctive. In Ireland, we have a secretariat, which Nadine leads, and we have a steering group, which serves as a governance or board structure for ESTHER, and a number of people from the steering group are here today. And what we're doing here is in Ireland is our role is the ESTHER programme is to facilitate good quality partnerships. It's not about joining ESTHER. It's about encouraging people to develop these kind of institutional partnerships because we believe they're good for health and development. It's a good way of working. And to encourage people, if they're going down that road, to do it well. So our commitment is to high-quality partnerships. And so our role in ESTHER is really to facilitate people along that journey. Maybe at the very start, they want to start something. How do you start a partnership? Give some guidance, to refer people to some tools, provide training. And then as they go on that journey, and maybe they need to really meet the partner, develop the relationship, and we have a startup small grants program. So that allows people, and some of you have availed of this, to get them funding so that you can go out and meet your partner, learn what their needs are, understand from their perspective what might work, see how you can work together as partners. And then also funding that will enable them to come to Ireland, because there's also value in that for them to come and meet the partners here. And we've been fortunate to be able to give out now more than 20 grants and 2 different institutions. And then as partnerships proceed, our role is to be there to try and facilitate the development of those partnerships. So a meeting like today is about bringing people together to learn from each other, because we can always be learning as what things work and how they work well. And as partnerships become established, then we invite people then to apply to become recognised as ESTHER partnerships. And again, it's not about ESTHER per se, it's about that recognition that what the partnership is doing is high quality. So any partnership that's committed to following the ESTHER Charter of Quality and the standards of quality, we invite and welcome them to become ESTHER partnerships. And we hope that recognition will help in their development and in areas such as seeking funds. So I'm just back from Mozambique, where I was with our colleagues here last week, and just say a few words about the partnership there. And it's the one I'm probably most directly involved in, and I'm very excited what's happening in that partnership. And I'm not going to say too much because Eleni is going to present on it later, and I'm very much looking forward to what she's to say about it. But this partnership has developed out of an agreement between the HSE and the Ministry of Health in Mozambique. And it's a really important partnership for us in the HSE because it is at a national level. It's at the level of the national organisation. And I think it's also, we recognise from visits to Mozambique, very important to the Irish Aid programme in Mozambique, that they see this as important. It's complementing and adding value to the work that they're doing with the government there. So this, too, has come out of the MOU with Irish Aid, between the HSE and Irish Aid. I think it's just a very good example of what having that framework of that MOU has been very valuable for. But last week, I just had the pleasure of meeting people for a training workshop coming from 14 hospitals, teams from 14 hospitals and the Ministry of Health, coming and presenting on projects that they were working on, which is only a short time following an initial training that took place in August. And it was really quite remarkable to see the quality of that work, how they'd taken on the concepts and methods and quality improvement that they'd learned, how they were using that to address quality problems in their hospital, and already presenting the results of what they were doing, even in a short time, showing some of the changes that are happening. And I think it's very exciting because I think this can have a real impact across the whole country in terms of improving quality of hospital services. So we'll hear more about that from Dr. Elenia and a little bit later. And I just want to really maybe say one thing that I don't think she's going to say, which is today we're trying to learn about what works in partnerships. And I think one of the key things about this partnership is the leadership of the Ministry of Health. That, to me, if there's any single ingredient or success factor, to me that's the key thing, because that's what's making this work. And to see the leadership from Eleni and her colleagues who are so committed to improving the quality of the services. Resources may be scarce, but they want to do better with what they've got. And in that environment, it's very nice then to come in and just be able to be part of that and work together on that. So I think the way that maybe the last thing we want just to say is really just to express from the HSE side is our appreciation to Irish Aid just for the opportunity to collaborate. That has led to the Ester programme and initiatives like some of the ones I've talked about and what you're involved in. I think this is a great collaboration. I think when the MOU was signed in 2010, a lot of our thinking was this is about Irish Aid being able to avail of some of the expertise in the health service to support what they do. But what we've seen is that it's given opened up huge opportunities within the health service for many people to get involved in global health activities, particularly through institutional partnerships. And that, in turn, I think, is also then contributing to the work of Irish Aid in countries where we're working and to the objectives of the aid programme. And, you know, we couldn't have done all this without the support from Irish Aid too, in terms of the funding for the Secretariat that enables us to facilitate this work, and also for the grant funding. So I really look forward to that continuing. We're actually going to be renewing the MOU quite soon, so this is a very significant time. And I think that this will be a very important part of that relationship, and look forward to hopefully facilitating lots of new partnerships, but also continuing to work with all of you in development of partnerships, and really continuing to work to a place where we're getting very, very good and effective results. So I think today is a great opportunity for us to share with each other, and I'm very much looking forward to hearing the presentations and interacting with you all. Thanks.